Healing is what happens when medicine is personal. Dr. Sweet was making that very clear. By personal, I mean thoughtful, honoring of the person, their meanings, their beliefs, their history, their experiences. Gosh, Mrs. Jones, you've been sober now for 3 years. This is fabulous. Let's take a moment and celebrate this. Second case. I call this, he's wasting our time. The story is, I had been seeing I gave a noon presentation to the medical residents. It was on informed consent. They were not kind of like getting into it. They were just kind of like, I said, you guys are restless. Something is going on. Bring forth what you think is an ethical challenge on the wards right now. And they all jumped in, oh, Mr. fill in the blank. I said, well, tell me about that. You know, he was admitted for severe bradycardia. And it's very simple. He needs a pacemaker, but he's refusing. And he's just taking up space. He's wasting our time. Huh. Well, I said, let's explore what it means about duty to others, and let's talk about what's going on. We went through this. I returned to my clinic, and a couple hours later, there's an add-on to my schedule. I go and look at the chart, and I say, oh, the residents have a sense of humor. They discharged him to my clinic. And I said, okay, so I prepared the interpreter. And I said, here's the story. Okay. His chief complaint was cough and weakness. And I said, so just bear with me, and she and I partnered together among patients. So I walk in, I introduce myself. Najong, Kanalija, Jikadwa, Gununa, Plotnikoff. And ho, 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 ho. If people didn't laugh with that, they're depressed. He's not depressed. I said, I want to tell you I'm here to be helpful. And I want all decisions that you make to be in accordance with what's most important to you. I said, and so I want to partner with you on this. Now, I understand there's been concern about your heart rate and a pacemaker, and so tell me about that. Are you working with a Hmong shaman? Are you working with a Hmong herbalist? Tell me about your next steps. He said, oh, no. I'm part of the new culture. New culture? What's that? He goes, I'm Christian. Oh, tell me about that. Well, now he's a Christian, but he's very active in a church of new Hmong Christians, and who has a strong belief in this all-powerful, loving God who was going to take care of him through prayer. I said, okay, let's talk about that. And we just talked and talked and talked. Obviously, he was stable. He was doing okay. He could talk in full sentences. He could walk into the clinic, other things. So there was no rush. We did an exam, and I said, you know what? We've been going kind of long today, and I feel there's so much more. Would you be willing to come back tomorrow? He said, yes, for 2 reasons. One, you're the first doctor who's ever spoken Hmong with me. Second, you're the first doctor who's ever asked me about what's important to me. I said, okay, cool, we've got a working relationship. Welcome him back the next day, not pushing for closure, but knowing with a heart rate in the mid-30s or early 40s that he would likely to benefit from a pacemaker, but I wasn't going to push it. We talked through his dilemmas, and I said, well, gosh, we need to wrap up now. And I said, but for 2 days now, you've talked about the power of prayer in your life. I had got an okay from the interpreter, and so I invited him. I said, would you like to close today with a prayer? He said, yes. And so we all joined hands, and I said a few general words wishing him health and well-being, courage and strength and like. And then he launched into a prayer in Hmong that went on and on and on about 8 minutes. And we concluded, and I said, okay, I'll look forward to being helpful whenever I can. He said, I'd like that pacemaker now. Oh, 4 o'clock Friday, okay. So I called the cardiologist, the case goes, Plotnikoff, what the hell? We spent a week with this guy going point by point by point. I said, yes. Sometimes people make decisions on what they most believe. In fact, we all make decisions on what is most important and what we most believe. And that can be data, or it could be something else. And so the kind of lesson here is, interviewing for meanings and beliefs and interpretations, someone's uniqueness. What is most important to them? What would make this a really good visit for you today?